Dr. Saab, could you hear me?
Yes, clearly.
Perfect. All right. So we'll begin, alhamdulillah, with some technical difficulties where we get to begin, alhamdulillah. So, Bismillah ar-Rahman ar-Rahim, nahmaduhu wa nusalli wa nusallim ala rasulih al-kareem amma ba'd. Um, we have Dr. Sayyid Sabahat Ali with us tonight. We say Jazakallah khairan to Doctor to spend a few moments with us. Before I ask Dr. Sayyid to give us um, some updates, I will introduce him, inshallah. Uh, Dr. Sabahat Ali qualified as a doctor at the age of 23 from Nigeria, and he worked in Trinidad and Tobago before coming to the United States. Mashallah, he was the assistant clinical professor at St. Louis University, St. Louis University, and had his own private practice in Belleville, Illinois. He joined the Sutter Medical Foundation 12 years ago, and mashallah, he also did his executive MBA at California State University, Stanislaus, and currently he works out of Stockton. He took out his time today to update the community about what are the latest developments on COVID-19. And without further ado, Dr. Sayyid Ali, please proceed.
Assalamu alaikum. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت إنا أعطينا الكوثر فصل لربك وانهر إن شانئك هو الأبتر. So today, what I will divide this webinar first by giving you what is coronavirus, then telling you what are the symptoms, and lastly, I will tell you how to protect yourself. Mashallah, Maulvi Saab will tell you the religious aspect of it and what Islam believes and what are the guidelines from Prophet Muhammad, peace be upon him. So the coronavirus is a group of related viruses, okay, that cause disease in mammals. Mammals are human beings, animals, and all that, as well as birds. Now, coronavirus causes respiratory tract infections that can be mild, such as a common cold, okay? But it can also be severe, such as you must have heard of SARS, MERS, and now the latest COVID-19. Now, the in animals, in chickens, it causes respiratory disease. In cows, it actually causes diarrhea and vomiting. So, but eventually what happened was that the coronavirus, its generic and scientific name is Scotophilus bat coronavirus 512. It converted from the bat and was transferred to the human beings. And then it also changed itself, and now it can transfer from humans to humans. And because this was never a virus that was in humans, we do not have any immunity whatsoever to it, and that's why it is causing a pandemic and an epidemic. So remember when the Europeans came to America, they brought in their chicken pox, and that killed a lot of native Indians. That's exactly what is happening with this coronavirus, that it is spreading around the world like wildfire because human beings have no immunity to this virus. So how does it spread? It spreads person to person less than 6 feet. Now, we just recently got to know, we originally thought that it was an airborne virus, but now we are describing it as a droplet virus. That means that when you cough or sneeze, you can spread the virus in the air, droplet forms, and if it goes into the nostril, the eyes, the mouth, all right, or your hands, and then you put your hands near your mouth, nose, or throat, it can get into your system and cause the disease. The good news is that 85% of the people would get well. However, the 15% or so that will not get well are usually the elderly, the people who are immune compromised, people who have diabetes, hypertension, and other comorbid conditions, people who have cancer and are on treatment on chemotherapy, people who have rheumatoid arthritis and latest they are on latest immuno modulation medications like the new medications that everybody is so happy about that treats rheumatoid arthritis, psoriatic arthritis. They can also be at risk. People who are on steroid therapy regular, that means oral regular steroid therapy, they can also be at risk. People who have respiratory diseases like severe asthma, COPD, they are on oxygen. So all these people are prone to getting the disease. And since they are already immunocompromised and their respiratory system is not working well, they are the ones that end up in ICU and, God forbid, uh, die from it. Allah save us from the azab. So uh, now, what what is it that we can do to protect ourselves? Now, the number one thing is wash your hands. People are saying, oh, I can wear gloves. But the problem with wearing gloves is that you forget that you touch something. And then if you take the same glove hands and you put it on your face or near your eyes or near your mouth, the virus can easily get in because the virus stays on any plastic, latex, or glove surfaces for at least 6 to 7 days, on cardboard surfaces only for 1 or 2 days. So that's why it's very important whenever you touch anything, whenever you go out to the supermarket, if you and you come back home, be, be- before touching anything, you wash your hands. And washing your hands should be for 20 seconds. Now, I timed it. If you say Suratul Fatiha and Suratul Ikhlas while washing your hands, it will take exactly 20 seconds. The virus is carried on the fingertips. So make sure that you wash your fingertips very, very carefully. People who are at home and they find that somebody has got a common cold, it is important to restrict them to a room, and they should be using that room and that bathroom to themselves. Whenever other people go and clean the place, then they should always wash their hands after they're done, and then come out and use a paper towel or so to open the door handle to open the to open the door, and then leave the room. It The sanitizers that you can also use if you don't have water must have at least 60% of alcohol content. That kills the virus. If you're going to clean any surfaces at home, make sure you leave the spray. Clorox spray are very good, but you spray and leave it on, let it dry. That is a better way of killing the virus. You have got to clean the surroundings every 2 or 3 days, because you never know where the virus can, who has come into the house, who has not taken the precautions. So it's better. Cleanliness is godliness in Islam. And here is where you are going to practice cleanliness. MashaAllah, we pray 5 times a day. So inshallah, people who pray 5 times a day, they are washing their hands and cleaning themselves. So the key to protecting yourself is washing your hands. um, Avoid touching your eyes. Take care to avoid touching your eyes or mouth. If you have touched something that you don't know whether anybody has touched, and then make sure you go and wash your hands. I know that you guys have lots of burning questions, so I will leave a lot of space for questions, because there are a lot of things that are going on. Now, the latest on our community, what is the spread rate? The good news is that majority of COVID-19 tests that we have done in Stockton, they're coming back as negative. I do not know the stats in Lodi as yet, because we do not have a direct connection with Lodi Memorial Hospital. But so far, St. Joseph, San Joaquin, um, they they were expecting much more rates than what we have got. But remember, we are not testing everybody. The test kits are limited, so there is a lot of people, that especially young people, that are running around, that are healthy. They have the virus, they don't have the sickness, but they can easily spread it to the elderly and the immunocompromised. Children, mashallah, are somehow or the other are not getting the disease, which is great news. We don't know why. We are still understanding the transmission of this virus, but so far, kids who have been even exposed don't get the disease and don't get sick, but they can still carry the virus. So, mashallah, I didn't. I think that is enough information for today, but I will be available for questions.
Jazakallah khairan, Dr. Sayyid Sabahat Ali, um, for that informative information. Um, it's great to have, mashallah, a great a local doctor to share some information with us, because that is when we know exactly what's happening and how to proceed. If there are any questions, those of you that are watching this over Zoom, you do have an option of asking questions. Those of you that are watching live on YouTube, you could also ask questions in the comments below. I will be looking at them as well, inshallah. Um, I do want to share a few things because I don't see any questions yet. But as questions come in, Dr. Sabal, I will share with you, inshallah.
Inshallah.
Is that the few things I do want to share is نحمده ونصلي ونسلم على رسوله الكريم أما بعد, is that remember that Allah subhanahu wa ta'ala is in full control, and Allah subhanahu wa ta'ala is testing us, and Allah subhanahu wa ta'ala is testing us all the time, not only when He sends us, He allows this kind of virus to spread, but but uh, whenever we are doing well and financially we're okay. So remember that Allah subhanahu wa ta'ala is always testing us. Allah subhanahu wa ta'ala is always in control. There is one a very important point that I do need to point out, and that is the belief system of a believer, and what I mean by that is the concept of relying in Allah subhanahu wa ta'ala, to have full reliance on Allah subhanahu wa ta'ala. We find in various ahadith we find in various examples in the life of Rasulullah sallallahu alaihi wasallam that Sahaba Ikram, in one instance, for example, one Sahabi, he asked Rasulullah sallallahu alaihi wasallam that, "Oh Rasulullah, I have this camel. Should I just leave the camel at this door and then rely on Allah, or should I tie it and then rely on Allah?" So Rasulullah sallallahu alaihi wasallam advised that Sahabi, and he said, tie it first and then have full reliance on Allah subhanahu wa ta'ala. We live in, as Muslims, we understand we live in Darul Asbab. We live in this realm of means. It's when you have a key, then you're able to unlock the door. When you have the key, then you're able to start the car. When you have, like everything, this is how Allah subhanahu wa ta'ala created this realm for us. And it's imperative that we understand that some people believe that we need to skip the step of adopting means. And with all due respect, that is not the correct understanding that a person has, right? So a person is facing a challenge. And I see some Muslims, they are jumping over that step of carrying out those checking off on the prerequisites of the means, right, of locking the door or isolation, for example, in this aspect, and then relying on Allah subhanahu wa ta'ala. What I see some people doing, especially in San Joaquin County, Lora area, is that they're faced with this challenge of this virus, but they're going directly to tawakkul. And this is not what our Prophet ﷺ taught us, right? Yes, there are examples in the lives of Sahaba where Mu'az radiallahu ta'ala anhu, Khalid ibn Walid, for example, Khalid ibn Walid radiallahu ta'ala anhu, he drank poison, right? Or Ali radiallahu ta'ala anhu, him being able to lift an entire gate by himself, or Umar radiallahu ta'ala anhu, whipping the ground and the earth stopped shaking. See, those are special scenarios. That is not normal. Okay, that was those were things that Allah subhanahu wa ta'ala allowed to appear with them. Rasulullah sallallahu alaihi wasallam taught us, the common person, the common layman, and that as far as facing a challenge, you tie the camel, you rely on your means that I've given you. And what are some of the means that we have? This is what everyone has been hearing from every level of government up to World Health Organization, is isolation, right? And no, isolating yourself and preventing the spread of this disease does not negate your iman, right? Dr. Saab, a lot of people believe that by me going to the masjid, by me going to the masjid and praying Jummah means that my iman is weak. No, it has nothing to do with your iman. We have to understand that this is how things work. We have to rely on the means. There are a lot of fatwas fatawa that are out. The proper plural, the proper way of saying the plural of fatwa is fatawa. So I just made up fatwas, right? So there are many fatawa that we find from all over the world that gives us the reasoning to shut down our masajid, even for daily salah, to prevent the spread of this disease. And my dear respected brothers and sisters that are watching live, the last thing we want is for anyone to point a finger at the Muslim community of Lodi and to say, you guys were the ones that contributed towards the spread of this disease. We cannot afford that to happen. So that's the point that I'm making, is that by relying on the means does not negate your iman, right? In fact, it's part of being a Muslim to follow what Rasulullah ﷺ said, regardless of how you and I personally feel that, oh, I'm invincible and I could do this. No, that's your emotions are to decide, you do what Rasulullah sallallahu alaihi wasallam told you to do. In that instance, for that Sahabi, he told them to tie the camel and then rely on Allah. In our situation, we are to,
Excellent.
isolate ourselves, which is being told to us. So, and I will tell you, is that it was a difficult decision for me to make, to shut down a California Islamic Center, especially for Jummah, right? Last Friday, CIC was the first masjid in San Joaquin County, in my opinion, and as far as I know, to shut down Jummah, and that raised a lot of question marks that what's happening, but that needed to happen. And then you see, literally every other masjid besides one or two masjids in San Joaquin County shut down. Islamic Center of Stockton shut down, Medina Center shut down, Noor Center shut down. You had Masjid Iman that shut down. You had obviously, California Islamic Center that shut down. I believe Manteca also shut down, but there were just 2 or 3 masjids that were open. But Allahu Alam, this is something that the management is deciding what to do. But again, relying on means does not negate your iman. Dr. Sab, I don't see any questions yet.
Okay.
If there are any, let me check on YouTube here. No questions on YouTube either. What is it that we could do as Muslims? So, washing our hands, isolation, believe it or not, all of these things which are being instructed to us are now Islamically our duty that we must do. Okay. We find in Sahih Bukhari that Rasulullah SAW said that black seed, or black cumin is also known, is a cure from all diseases except death. And this is something that we could find inshallah ta'ala easily. I take it every morning for the past few days, alhamdulillah. To have honey also, the Quran mentions there's cure in honey. So I do want to share the disclaimer is that consult your doctor if it's safe for you to consume black cumin and also for you to consume honey. But make a lot of istighfar, make a lot of dua. I will conclude this one point, inshallah ta'ala, is that we, like, what am I learning from this as an imam? Is that personally, I believe that this is a wake-up call for us as Muslims. I believe we used to take our masajid for granted. We used to take Jummah for granted. We used to take our children's classes, weekday classes, Saturday school, our programs. Subhanallah, we had a cabin trip scheduled for now. I was supposed to, be at a cabin trip. We had people sign up. We had to cancel. We had a janaza workshop that so many brothers and sisters were looking forward to. We had a sleepover that was supposed to happen last Friday. All of these programs that were happening, they were a blessing of Allah subhanahu wa ta'ala. And I remember very clearly, those of you that remember, when I first got to CIC, like almost 2 years ago, I would say that the same Allah that is allowing us to have these programs and is allowing us to be here at the masjid is the same Allah that could take these things away from us. And here we are on March 20th, 2020, 3/20/2020, that as of right now, Allah subhanahu wa ta'ala has taken these things away from us. We need to make a lot of istighfar. We need to isolate ourselves, wash your hands, do what the health professionals are, the health authorities are telling us to do. And I'm telling you as an imam, there are so many conference calls that I've been on with so many ulama, with so many imams from all over, locally, state level, national level, meetings, etc. Ramadan is as of right now, make dua that we're able to experience the month of Ramadan. But Dr. Saab, we see that it doesn't, as of right now, Allahu Alam, but it doesn't look like we're going to be able to experience Ramadan. Is that correct?
Yes.
Based on the stats that
Based on the stats, we have not yet reached, because the curve is still growing up. Now, we can flatten the curve by isolating ourselves. So that's what we are doing. By doing that, we might be able, if God willing, might be able to do the Ramadan. So that's why it's very essential for us to isolate so that we don't spread the disease, so we can, mashallah, practice Ramadan.
Inshallah.
Inshallah.
Okay, Jazakallah khairan, Dr. Saab. Again, very much. May Allah subhanahu wa ta'ala reward you, bless you in everything that you do. And I will share with the viewers that it was Dr. Ali's idea. It was his ambition. It was his idea. Is his ikhlas that he said, Yasir, we should do this for the community. And I said, MashaAllah, let's do this. Dr. Saab, before I
Thank you,
conclude,
Maulvi Saab, for arranging this and doing the technical stuff.
Alhamdulillah, alhamdulillah. I'm able to, tap a few buttons on the keyboard. Alhamdulillah. Dr. Saab, you and I have been working on the clinic that was supposed to
Clinic.
open at
Yes.
CIT. So just to share with the viewers, it was Dr. Ali, mashallah, behind the scenes who was volunteering to do this. Make dua that Allah allows us to launch that. We were planning on launching it in Ramadan, but again, make a lot of dua, isolation, wash your hands, do whatever we need to be told, regardless of how we feel emotionally. Jazakumullah khairan.
Thank you.
All right. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wassalamu alaikum.